Christiane Amanpour is almost done with her chemotherapy treatments. CNN's chief international anchor revealed in June she had been diagnosed with ovarian cancer and appeared on Good Morning America with Robin Roberts Wednesday to share an update on her health journey. It's now the end of my chemotherapy that I announced back in June. Tomorrow is my last session after 18 weeks of what you know, because you've been through a similar struggle, is grueling, fatiguing, tiring and emotionally wearing as well, not to mention physically, and can be scary, Amanpour told Roberts, who underwent chemotherapy for breast cancer in 2007 and a rare blood disorder in 2012. The Emmy-winning journalist added she's received care at some of the top cancer treatment facilities in the world, and thanked her two unbelievable women, a surgeon, an oncologist who've looked after me, and her colleagues, family and friends for their support. I have been so lucky, Amanpour said. This is so important. It was early detection on my part and on my doctor's part. I would not be swayed when I felt a pain that was unusual, and I pursued it to the very end of getting my very first ultrasound, which is the benchmark for then having a baseline to know whether you've caught it in time, or not. In June, Amanpour shared her cancer diagnosis with viewers during her CNN international program Amanpour, from which she had been absent for 4 weeks at the time while undergoing treatment. Like millions of women around the world, I've been diagnosed with ovarian cancer, Amanpour, 63, said. I've had successful major surgery to remove it, and I'm now undergoing several months of chemotherapy for the very best possible long-term prognosis, and I'm confident. According to Mayo Clinic, ovarian cancer is a common cancer among women that starts in the ovaries, and spreads to the abdomen and pelvis if it is not diagnosed and treated early. CNN anchor Christiane Amanpour reveals she has ovarian cancer, confident in recovery. Amanpour said she publicly shared her diagnosis not only for transparency, but to highlight the importance of an early diagnosis and to urge women to educate themselves on this disease. Get all the regular screenings and scans that you can, Amanpour said. Always listen to your bodies, and of course to ensure that your legitimate medical concerns are not dismissed or diminished. Contributing, Sydney Henderson.